so-called bacterium. But now the specific medication that's going to be used for Bordetella pertussis is going to be, in addition to all those medications, we use macrolide. Is it clear? You can use macrolide in the case of Bordetella pertussis, and you have also aerobic action. As I've also explained, the aerobic action makes it to be targeted by the macrolide. Corynebacterium diphtheria, you can use macrolides, particularly also in Corynebacterium diphtheria, if you don't have to use the medication for gram-negative and the aerobic action. So you use macrolide specifically here. Bacillus anthracis, you use penicillins. I made a small mistake. The Bacillus anthracis is a gram-positive and aerob. Is it clear? Bacillus anthracis is gram-positive aerob and not gram-negative aerob. And this is the reason why Bacillus anthracis is targeted by penicillins. Is it clear? So please remove this from here. Bacillus anthracis is among the gram-positive aerobs and not the gram-negative aerob. And this is the reason why Bacillus anthracis is being targeted by penicillins. So Bacillus anthracis is targeted by penicillins because of the gram-positive action. Is it clear? The Yersinia pestis, is it clear? So to treat Yersinia pestis, the gram-negative action make it to be targeted by third-generation cephalosporins. The aerobic action make it to be targeted now by the macrolide and also the penicillins, as I've just explained. Is it clear? The Bacillus anthracis is also going to be targeted by the aerobic action, make it to be targeted by the penicillins. Is it clear? So those are the different things that you have to visualize. Now for the gram-negative aerobs, for the gram-negative anaerobes, the gram-negative action make it to be targeted by the sulfamethoxazole trimethoprim, is it clear? And the anaerobic action make it to be targeted by the metronidazole. The gram-negative action make it also be targeted by third-generation cephalosporin. That's why Enterococci, you can use all of them. Third-generation Enterobacteriaceae, you can use third-generation cephalosporins, or you can use cotrimazole, or you can also use the last one. Is it clear? So Fusiform bacterium, particularly in Fusiform bacterium, Streptococcus, Gardnerella, and Bacteroides mostly use metronidazole. Is it clear? In Fusiform bacterium, Streptococcus, Gardnerella, Bacteroides mostly use metronidazole. In Neisseria, you use third-generation cephalosporins peculiarly. In Pseudomonas, we are going to use anti-pseudomonal medication. Is it clear? Pseudomonas is one of the most feared microorganisms. Is it clear? So when you have Pseudomonas, you use anti-pseudomonal medication. Anti-pseudomonal medication, we are the first one, you can have anti-pseudomonal penicillins. Is it clear? So anti-pseudomonal penicillins. Among the anti-pseudomonal penicillin, you have piperacillin. Is it clear? Piperacillin. Is it clear? Among the anti-pseudomonal penicillins. Now, we can use anti-pseudomonal cephalosporins. Anti-pseudomonal cephalosporins. Is it clear? Among the anti-pseudomonal cephalosporin, we have third-generation cephalosporin called ceftazidime. Is it clear? And this ceftazidime is used in the second line for the management of neonatal sepsis because it's going to target also the Pseudomonas. Is it clear? And then the third one, anti-pseudomonal, we have also the anti-pseudomonal cephalosporin, which are the fourth generation cephalosporin. Example is of the fourth generation cephalosporin is cefepime. Is it clear? Which is also going to have the anti-pseudomonal action. Is it clear? So that's how you treat anti-pseudomonal. Now for the Haemophilus influenzae, you need to know that they have beta-lactamase inhibitors. Is it clear? That's what they have beta-lactamase enzyme. That's why in case of Haemophilus influenzae infection, we need to use beta-lactamase inhibitors. Is it clear? And you use example of beta-lactamase inhibitor is a clavulanic acid. Is it clear? You have clavulanic acid. Now, that clavulanic acid is going to be used with amoxicillin or a penicillin. So, in the case of Haemophilus influenzae infection, you use amoxicillin clavulanic acid as the management. Are you understanding? So, that is what you're going to use as specific medication here. Now, for the Zell-Nelson, the specific medication is peculiarly rifampicin. Is it clear? For all the microorganisms under the Zell-Nelson family. For the intracellular microorganism, Mycoplasma, Ureaplasma, Chlamydia, Derichetta, all of them are peculiarly treated with two medications, which are macrolides and tetracyclines. Is it clear? And among the example of macrolides, we said erythromycin, clarithromycin, and all that. Is it clear? Now, the next one are the others. Is it clear? For the others, for the different morphology, I've already explained that in the latter tutorial. I need again to come back on the medication that was treated by. The last thing that I wanted to say is that the enterococci can be targeted by gentamicin. Is going to target enterococci, but among the other classes of other medication can also target the enterococci. Is it clear? And those are aminoglycosides. Is it clear? The aminoglycosides, all of them target the enterococci. Is it clear? An example of aminoglycoside, I've just taken only one example. We have gentamicin, we can have amikacin, and we have also streptomycin. Is it clear? So those are the different medication that you are going to have in this that's going to target the enterococci. And you need to know that another importance of enterococci, apart from targeting another importance of aminoglycoside, apart from targeting enterococci, is that aminoglycoside can potentiate the beta lactams. Is it clear? They potentiate the beta lactams, particularly cephalosporins. Is it clear? They potentiate the actions of beta lactams, particularly cephalosporins. Is it clear? So those are all the medication with respect to the classification of the SchrDbb according to classification of SchrDbb. So I hope this is going to be useful for you. Thank you.